Okay. Good day, everyone. We will be discussing this day the topic sexual and reproductive health of adolescents. I will be discussing it under this outline: the rationale for focusing on adolescents, the priority health challenges of adolescents, and the characteristics that we need to put in place to meet the health needs of adolescents. Moving forward, who is an adolescent? Adolescence, according to WHO, is the period between 10 to 19 years. And as you can see in the pictures, various age categories fall under adolescent age group. However, by National Adolescent Health Policy, it classifies adolescents as ages 10 to 24, where it was further categorized as 10 to 24 for young people, 15 to 24 for youth, and then 10 to 19 for adolescents. Why are we actually concerned about the sexual and the reproductive health needs of adolescents? We are concerned because about 22% of Nigerian population is between this age group, which is 10 to 19 years. Also, 7 out of 10 in-school males, as well as 5 out of 10 in-school females, have been noted to have reported sex at least once in their lifetime. 40% of secondary school girls admitted to at least having had one previous pregnancy. 1 out of 20 adolescents contract sexually transmitted infections yearly. In addition, 60 to 80% of patients that present with postnatal complications have been noted to be adolescent girls. And in furtherance, maternal mortality has been noted to be 7 times higher among teenage pregnant women compared to people that are aged 20 to 24 years and above. What are the various health risks that we actually have as relates to adolescent health? These include early unwanted pregnancy. They are at risk of septic abortion or unwanted, are at risk of sexual abuse and violence. Alcohol and substance use and abuse is not left out. Adolescents are also vulnerable to risk associated with early sexual activity like gonorrhea, syphilis, and other sexually transmitted diseases, including HIV and AIDS. They're also at risk of harmful traditional practices like genital mutilation, as well as limited access to adolescent-friendly sexual and health services, which they badly need. Adolescents are also exposed or at risk of inadequate policy orientation that will meet their health needs, and are also exposed to nutritional, psychological, economic, and gender inequalities that compound their sexual and reproductive health. Moving one after the other on this sexual rate, first is the unwanted pregnancy. Why does it result? It results because they are exposed to early unprotected sexual intercourse. And pregnancy and childbirth carry greater risk of morbidity and mortality for these adolescents than for women of older age groups. And because of this risk, they are associated with this risk tends to compound their situation more because that's for adolescents compared to adults, are exposed to prolonged labor, obstructed labor, hemorrhages, hypertension, anemia, and other debilitating conditions. And as a result of this unwanted pregnancy, these young persons are exposed to psychological and socioeconomic consequences, such as psychological stress, poor self-esteem, lack of hope, social stigma, leaving home, prostitution. There's also disruption of their education, as well as poor academic achievement, which of course, no doubt, will affect their socioeconomic future, affecting their earning capacity, as well as fewer chances of having job opportunities. They also tend to have unstable marriage and unwanted child resulting from such unwanted pregnancies. Secondly, we also have a self-abortion as a high risk for these young persons. It has been noted that 1 in 10 abortions occur worldwide among people aged 15 to 19. And this is more common in developed countries, in developing countries, which of course is not surprising. Most of these procedures are performed under very unsafe conditions as a result of lack of access to safe services, self-induced methods, unskilled and non-medical providers. And because of this unsafe abortion, there's a lot of complications that result from it, which could include infection, hemorrhages, intestinal perforation, injury to the reproductive organ, and of course, even result in infertility and at times death. As you can see from the picture there, somebody that just took rat poison just to be able to be able to contract abortion. So definitely the complication is numerous. These young persons, especially adolescent age group, are also at risk of sexually transmitted infections like gonorrhea, syphilis, of course, and HIV. They of course is not left out. They tend to be at risk of these diseases, and they can lead to long-term health problems like infertility. You can see a case of syphilitic ulcer, herpes simplex, and the rest of them. These young persons are also exposed or at risk of sexual violence. Worldwide, there have been a lot of reports about sexual abuse affecting the adolescent. 1/3 of teenagers experience this abuse. And because of this rape, involuntary prostitution, and various kinds of sexual abuse, these young people are exposed to physical trauma, unintended pregnancy, sexually transmitted infections, psychosocial trauma, as well as increase in likelihood of high-risk sexual behavior. How do we actually solve these problems? Of course, the problems are so numerous, the risks are so numerous. So for us to be able to curb it, there's actually need to ensure that we provide services that actually meet their health needs, services that are friendly, services that are affordable, services that are accessible, so that these services should include both information and clinical services, so that their health needs will be met. And what should be the characteristics of these services so that these children or these young persons or these adolescents can access it? One, there should be confidentiality. Yes, the health worker should be able to provide confidentiality and privacy for these young people, so they'll feel free, they'll feel at ease to come and access these services. The locations should be convenient and as well as accessible hours. If the young people prefer coming to these health facilities during the evening times, where probably they won't be seen by the adult, health workers should avail such opportunities to them so that they can access. Then the environment should be youth friendly, if possible. Recreational facilities that they could keep them busy, and while they're having their realization, they could also access some of these sexual and reproductive health services will actually be beneficial. It should be open to men and women, and there should be strong counseling component. It's not for health workers imposing their ideas or what they feel. They should be able to counsel these young children, give them adequate information and services so that they'll be able to make informed decisions and choices of what they want. Then the health providers should be well trained. Many a times these children come with these health needs, but they are not technically equipped to be able to afford these services or give them these services. So there should be continuous regular training or skill improvement on these health workers, so they will be able to provide the requisite and appropriate service for these young people. And of course, these services should be comprehensive. There are a lot of other health issues, just as we mentioned, psychological, nutritional, and the rest of them that also compound sexual and reproductive health of young people. So they should all be put into cognizance and adequately taken care of. So with that, our young persons will be able to have their health need adequately met. Thank you very much for listening.